Adolescent and young adult life is a really important part of human development, supporting that transition from the dependence of childhood to independent adult living. Healthcare during this time period, we try to adapt as much as we can so that it works for this age group, and we call this developmentally appropriate healthcare. It tends to include clearly straightforward healthcare, but also some work around health education and also peer support. The Newcastle Health Research Partnership adolescent work is a really exciting piece of work aiming to address vulnerabilities and needs relating to healthcare specifically for this age group. We've been working with systems engineers, with healthcare professionals, and most importantly with young people themselves to design improvements to adolescent healthcare.
So as a physiotherapist, I have next to no time in my job plan to deliver projects like this. So what the funding from Newcastle Health Research Partnership's done, it's allowed a bit of time to be bought from my work time to allow me the space and the time to complete this really important piece of work.
So the partnership brings together a range of stakeholders from across the health and care system, including NHS, local authorities and people with lived experience. And the idea is to use all of that collective experience and knowledge around suicide and self-harm to really make a difference in terms of how we approach and treat and manage this really important issue. Unfortunately, the North East and North Cumbria is one of the regions that is most affected by suicide in the UK. And so anything that we can do to make a difference to this is really important. So Newcastle Health Research Partnership played a key role in bringing the collaboration together, particularly in terms of reaching stakeholders and getting people engaged, and also supporting us with communications, which was really important in terms of getting the message out about what we were doing.
So we have the Young at Heart Clinic. Now this started in 2019, and this is where students, they run the clinic and they provide the equivalent of the NHS health check to members of the public. We started off providing that in the Granger Market, and then we also went out to local communities to provide this service to members of, again, communities that are often suffering from health inequalities. This initiative is really important for students and the local community. So students are practicing the skills they'll need, and also we found that it was adding value to the people that we're providing the services for. People really wanted these health checks, so it's really great from both sides. And Newcastle Health Research Partnership was really helpful in facilitating those conversations between the City Council and the university. We now have a dedicated Granger Market space. We have a lease for 3 years and we're hoping to continue those services.
The training programme is for researchers and public contributors across the region to expand their knowledge and understanding of public involvement in research. The public involvement session that I was part of was for public contributors wanting to get involved in research. A lot of researchers wanted to come to the session as well as public contributors, and it proved so popular we had a waiting list for both sessions, which shows the need for it in the region. I know that some of the public contributors who attended the session themselves have gone on to look into involvement in research a bit further themselves, and obviously that was what we wanted, to be able to inspire people and encourage them to get involved in research themselves.
This project was built upon a national educational project that I'd done through Cancer Research UK within the North East, where we've been working with universities across the North East region to educate undergraduate nursing students around what the role of a research nurse was within the NHS. From that piece of work, one of the findings was that we needed to create an e-learning course, and that's what this project was. It was translating all of the approaches to educating students within university, translated into a 5-module e-learning course. Newcastle Health Research Partnerships funded this project. They supported the project with having a project manager and linked me up with Newcastle University e-learning team, who translated this project from an idea into reality via working with me and student nurses to create this project.